And this was really for me a dream job on paper. I moved my family 2,000 miles and then the shoe dropped. With no business background and with zero business experience, almost 5 years to the date, I opened up Pazona MD. And 5 years later, I'm really proud of what our team has done. And just last week, I had our medical assistant, Sarah, come up to me and say, Dr. P, I wanted you to know that I love this team. No one's ever supported me this way. There are doctors out there who really do care, trying to do something different.
Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pazona, a board-certified urologist and CEO of Pazona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team. In this episode, I thought we'd do something different. We've had a lot of engagement on our TikTok channel asking more about me as a physician, why I went into healthcare, and where I'm headed. So I thought I would share with you my story because, listen, we got a broken healthcare system. And a lot of people don't have great experiences with their doctors and may not, frankly, think that much of doctors anymore. And so sometimes just hearing someone's personal story, you can get a little bit more empathy and understand where we're coming from. So, I didn't come from much. There was no golden stethoscope or, trust fund that I came from. I grew up in a very middle to lower middle class family in downstate New York. There were no doctors in my family. Most of my aunts and uncles and family were either musicians or firemen or had pizza, restaurants, which I'm sure with the last name Pazona comes as a shock to you. And so, I was lucky in that I was a good student. And, back in the 80s and 90s, when you're a good student, you're either a doctor or a lawyer. And so, I was definitely math and science focused, and I did some volunteer work as a kid. I went to some nerd camps and learned about healthcare, did some volunteering at my hospital, and ultimately said, hey, let's give this doctor thing a shot. And so applied to a medical program at Northwestern and was lucky enough to get in. And that started my path forward in healthcare, really not knowing what I was going into. After pretty much giving up my entire 20s, I went to school for 13 years after high school where all I did was work. Now, college, I enjoyed myself, don't get me wrong, but medical school residency was 10 years of just dedication to my craft and in the libraries and hospitals. And I remember walking the hospital at 4 or 5 in the morning as other people in Chicago were coming back from the bars. That's what I gave up to be a physician. And when I first came out of training, I said, well, I'm a urologist. I want to go to a practice where I can use my skills. I don't want to worry about all this business stuff. Let me just go be an employee. I'll let someone else figure out all that other, non-doctor stuff and just take care of patients. And it was great. I moved to Central Washington State. I was in the middle of the mountains and was a small town doc. My patients would come up to me in Costco and thank me for surgery and talk to my kids at the time. And it was really a magical place. But I also started seeing the ugly side of healthcare, the challenges that patients face with access, with just basic medical information, with getting in with doctors quickly enough. I saw the challenges hospital administrators faced with running razor-thin margins and not being able to give all the resources to us physicians. And I also saw as a doctor how, my patient's experience went beyond the 15 to 30 minutes they had in front of me. It depended upon who answered my phones, my medical assistant, whether or not the hospital's electronic health record made sense and worked. So there were all these other factors that ultimately, when I came up with ideas and said, hey, we should maybe think about doing this and it'll be better for the patients, I'd usually have someone who got an MBA online who was, quote, my boss, who said, Joe, why don't you just take it easy? Just go back to being a doctor. We'll handle this. We don't do things that way. And I'd say, why? And they go, well, that's just because the way we've always done it. And I quickly learned about myself, nothing drives me more crazy than being told this is the way we always do things. And so there got to be a point where I felt like I outgrew my job professionally. and I needed to look elsewhere, not knowing what I'd find, and ultimately was recruited to be a chief of urology and chief of robotic surgery at a academic department in the South. And this was really for me a dream job on paper. I moved my family 2,000 miles, a young family, because this looked like an opportunity of a lifetime to really build something that I feel can make a difference for patients. And then the shoe dropped and I got down there. And once they had me, I realized it was just a bait and switch. And wasn't the chief of urology. I was the chief of nothing. I quickly learned I was just another employee, a high-priced employee, but nonetheless an employee. And ultimately just kept being told the same thing. This is how we do things. Don't worry about that. And I just couldn't stand for it. I wasn't able to accept that my patients couldn't get a human being on the phone and had to drive an hour to another medical practice to get care. And so I raised red flags over and over again until one day they finally solved the problem. And the way they did that was they fired me. So here I was, a doctor. I was told, Joe, you're a great urologist, but quote, you don't fit in here. And here's this clause in your contract where we can let you go without cause. So you've got 6 months. If you say a single bad word about our hospital, we'll fire you immediately on the spot and you'll never have a job anywhere. Good luck. And at that point, really hit my low point in healthcare. I really went in with noble intentions. I really went in wanting to help people. And yet here I was, and I felt almost betrayed. Sure, there are things in retrospect I probably could have been a little bit more savvy. And, I'm a blunt New Yorker. I say what's on my mind. And that doesn't always go over well in the South. But regardless, I was doing it from a good place and a good heart for my patients. I wasn't asking for more money. I was asking for more support for my patients. And that's when, I just started thinking outside the box, realizing that at this point I had 3 kids. I was their only support financially. And I had to do something. I had to make it work. And that's when my journey took me up to Nashville. Of course, I joined a private practice where seemingly I had the autonomy and could kind of start building my own business and learning about it. And then if y'all remember in 2020, a little global pandemic hit. And so here I was, I just joined a new practice and revenue for the whole practice goes to 0. And they say in times of crisis, you see what a company or people are really made of. And when I looked behind the curtain, I saw that this group I had joined was not going to make it. And they didn't see the writing on the wall. And so with no business background, no business whatsoever doing this, I literally got a napkin and I wrote down, all right, you're making this much per month. These are your monthly bills with 3 kids in an expensive suburb. Here's your new overhead. Go make a business work. And with 0 business experience, almost 5 years to the date, I opened up Pazona MD. And I did so with finally the freedom to go build what I thought a medical practice should be, a practice where your phone was answered, where everyone in the office got along and wasn't catty and playing on their phones when you walked in. When you could sit down with a doctor and a team, they spent time with you and actually cared about you. And so here I was able to craft all of this. And 5 years later, I'm really proud of what our team has done. We have over 1,100 5-star reviews. We're the highest rated medical practice in the Southeast. And I think we have a fantastic team here in the Nashville and Brentwood area of Tennessee. Now, don't get me wrong. I've made hundreds of thousands of dollars of mistakes. And I know whenever a doctor takes out his tiny little violin and complains about how much money he doesn't make, it never goes over well. But, I'm making less money than I've ever made in my life. Now, I don't intend to do that forever. But what I'm really proud about is the experience we give our patients, the culture I've created. I'm finally part of an environment where I feel I belong. And just last week, I had our medical assistant, Sarah, come up to me and say, Dr. P, I wanted you to know that I love this team. And, no one's ever supported me this way. And, I'm getting emotional a little bit right now too, because that means so much. I care deeply about our team members and our patients, and we don't always get it right. We make mistakes, and there certainly are patients who don't have great experiences, but that's what we strive for. My kids tell me I cry all the time, so this shouldn't be a surprise to anyone watching, especially them. But it just shows that, there are doctors out there who really do care. And I mean this genuinely, that we're trying to do something different. And this is also lastly why we opted out of insurance. Some people say, stop with those crocodile tears. You don't care. You dropped insurance. Well, what I say to you is I would have had to close the doors of my medical practice if we kept taking insurance. Insurance hasn't even kept up with inflation, which since I've started my career is over 50%. There's no other industry where wages have gone down 50%, except in healthcare, and we think it's okay because, quote, we're all rich doctors. I literally would have had to close my doors, folks. And so instead I said, let's say goodbye to the middlemen. Let's serve fewer people more deeply. I hope to one day be at a point we can give out more charity care, but frankly, I've given out a lot of charity care, whether it's because an insurance company didn't pay me or I was the only doctor in Nashville taking Medicaid patients. And so, we don't always get it right. I know people are always going to have certain impressions of folks, but hopefully this very candid video of who I am, not just Dr. Pazona, but Joe, the guy who didn't come from much in New York, and really proud of what we've created here. So if you'd like to come and see how we deliver healthcare experiences, give us a call. We'd love to have you come and meet our team members. And until next time, show yourself a little bit more love and kindness. We're all works in progress, and these are opportunities to grow. Thanks, and have a great day. All right.
Put that on your website.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pazona MD, please visit pazonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.